My name is Fadul Rahman. I am a student of Group 17, Semester 4, International Medical University, and following is the topic of my discussion. Today, the topic of my discussion is drugs affecting on thyroid gland. The thyroid gland is a vital hormone gland. It plays a major role in the metabolism, growth, and development of the human body. It helps to regulate many body functions by constantly releasing a steady amount of thyroid hormones in the bloodstream. If the blood needs more energy in certain situations, for instance, if it is growing or cold or during pregnancy, the thyroid gland produces more hormones. This organ is found at the front of neck under the voice box. It is butterfly shaped. The two side lobes lie against and around the windpipe trachea and are connected at the front by a narrow strip of tissue. The thyroid weighs between 20 and 60 grams on average. It is surrounded by two fibrous capsules. The outer capsule is connected to the voice box muscles and many important muscles, vessels, and nerves. There is loose connective tissue between the inner and the outer capsule, so the thyroid can move and change its position when we swallow. The tissue itself consists of a lot of small individual lobules that are enclosed in thin layers of connective tissue. These lobules contain a great number of small vesicles called follicles, which store thyroid hormones in the form of little droplets. The thyroid hormone regulates the body metabolic rate, controlling heart, muscle, and digestive function, brain development, and bone maintenance. Its correct function depends on supply of iodine from the diet. Goiter. An enlarged thyroid gland due to any cause is called a goiter. For the gland to be palpable, it must be at least 40 gram. A patient with goiter may be euthyroid, hyperthyroid, or hypothyroid. Hypothyroidism, also called underactive thyroid, low thyroid, or hypothyroidism, is a disorder of the endocrine system in which the thyroid gland does not produce enough thyroid hormone. Symptoms of an underactive thyroid: tiredness, being sensitive to cold, weight gain, constipation, depression, slow movements, and thoughts, muscle aches and weakness, muscle cramps. Standard treatment for hypothyroidism involves daily use of synthetic thyroid hormone, levothyroxine, levothyroxine, and others. This oral medication restores adequate hormone levels, reversing the signs and symptoms of hyperthyroidism. Cretinism, congenital hypothyroidism, underactivity of the thyroid gland at birth, which results in growth retardation, developmental delay, and other abnormal features. Cretinism can be due to deficiency of iodine in mother's diet pregnancy. Hyperthyroidism. Overactive thyroid occurs when the thyroid gland produces too much of the hormone thyroxine. Hyperthyroidism can accelerate body's metabolism, causing unintentional weight loss and a rapid of irregular heartbeat. Several treatments are available for hyperthyroidism. Symptoms of an overactive thyroid: nervousness, anxiety, and irritability, mood swings, difficulty sleeping, persistent tiredness, and weakness, sensitivity to heat, swelling in the neck from an enlarged thyroid gland, an irregular and or unusually fast heart rate, um, twitching or trembling. Graves' disease is an immune system disorder that results in the overproduction of thyroid hormones. Hyperthyroidism, although a number of disorders may result in hyperthyroidism, Graves' disease is a common cause. Antithyroperoxide antibody. Standard treatment of Hashimoto's disease is levothyroxine, the synthetic form of thyroxine T4. However, extracts are available that contain thyroid hormone derived from the thyroid glands of pigs. These products, armored thyroid, for example, contain both levothyroxine and triiodothyronine T3. Uh, Potassium iodine, iodomarin, The most rapid effect at pharmacological doses of Ki is to decrease thyroglobulin proteolysis therapy, decreasing thyroid hormone secretion. The result is slight reduction of T4 and T3 concentration in serum cause transient increase of thyrotropin TSH concentrations in serum. Its eternal dose is its tablet must be 100 a tablet should be 100 or 200 milligram, and its half-life is 24 hours. Common side effects of potassium iodine include allergic reactions like skin rashes such as hives, swelling of various parts of the body such as face, lips, tongue, throat, hands or feet, fever with joint pain, trouble breathing, speaking or swelling, wheezing or shortness of breath. Levothyroxine, brand names Levoxil, Synthroid, and Unithroid. Levothyroxine oral tablet is used to treat hyperthyroidism. It is also used to treat goiter and certain types of thyroid cancer. Levothyroxine comes in three forms: an oral tablet, an oral capsule, and an injectable solution. Its internal dose is from 25 mcg to 300 mcg. Parenteral doses are 100 mcg per 5 milliliter. Its half-life is 6 to 7 days. The more common side effects of levothyroxine can include increased appetite, weight loss, heat sensitivity, excessive sweating, headache, hyperactivity, nervousness, anxiety. Anti-thyroid agents inhibit the synthesis of thyroxine T4 and thyroidothyronin T3. Its tablet is 5 milligram to 10 milligram. Its half-life is from 5 to 6 hours. Um, Methomazole, its Northex tapazole, its tablet is 5 milligram to 10 milligram. Its half-life is 5 to 6 hours. Pro Propylothyroxine propylothyroxine tablet, its tablet is 50 milligram, and half life is 1 to 2 hours. Common side effects may include nausea, vomiting, upset stomach, headache, dizziness, dwarfism, drowsiness, numbness or or tingly feeling, rash, itching, skin discoloration, muscle or joint pain, hair loss or decreased sense of taste. Mechanism of action: methimazole and propylthyroxine inhibits the production of new thyroid hormone in the thyroid gland. It acts by inhibiting the enzyme thyroid peroxidase, which usually functions to convert iodide to iodine molecule and incorporate the iodine molecule into amino acid tyrosine. Uh, Thank you for your attention.